not kidding. Like I can't even. I struggle to put my socks on. That's how bad it is. Like I have to like, like it's bad.
How
Yeah.
often is that?
Let's put it like this. In the last 3 months, I've felt that kind of pain 3 or 4 times.
It's a lot.
Yeah. When I went out of work for about a month recently in December, I felt like that at work, and I had to go home that day, and then I was out of work for a month.
You were describing it as more on the right side, right?
Yeah, like literally right down here. Sometimes it travels up to about here.
So it travels upwards.
Upwards. Yeah. Yeah, and then sometimes it'll shift to my left side.
So then when you feel it, do you feel it right when you wake up or later on in the day?
Well, when I wake up, it's really, really tight and sore.
Right here, right?
Right there, yeah. It's like, yeah.
All through here?
Yeah.
Let's come on back. Do you feel it?
Yeah. Just that right side, it's like it's...
Yeah, it looks wobbly into it.
Yeah.
Okay, well. Let's see. It definitely feels different on this side.
Yeah, it's really tight.
Interesting. So it only is like pinpoint into here, right?
Yeah. I had a steroid injection in my SI joint, and then they went into
Wait, you said a steroid injection into your right SI. Okay.
the right SI, and then they the last one, the cortisone shot, which was about 2 weeks ago, was in my
L5S1.
L5S1.
Yeah. Pretty much right into that little
Yep.
bit, right?
He did both sides, cortisone,
Both sides, okay.
both areas, and
Nothing.
as you can see, it's almost getting worse.
Yeah.
And he said, okay, do the pain patches, go to physical therapy, which I've been doing. He said, if this doesn't work, then call me and we'll schedule a procedure for that.
Okay.
So.
Okay, so he didn't tell you whether you want to do it, but he did confirm on the MRI that you have a bulge, right?
He confirmed on the MRI that I have a slight bulge, is what he said. For them to say that nothing's wrong, I know in the back of my head there is something wrong because the pain's not going away. So that's my body, telling me there's something wrong.
Most people have 5 lumbars.
Yes.
You actually have 6, right? So 1, 2, 3, 4, 5, 6.
Okay.
Right? This one is almost like the sacrum, but it does have its own disc into here. I actually think that's a lot of why you're having a lot of the pain that you're having.
Oh.
Right?
Okay.
So there's actually a couple of things, a couple of reasons. Yeah. So if they went into your L5, let me show you where your L5 is.
Yeah.
So this is 6 and this is 5.
Oh. Okay.
Right? You're feeling probably no more toward your 6, right?
Yes.
Than your 5.
The exact pain, it's tender right here, right where my finger is.
That's where your L6 is.
Am I just the lucky one who has a L6?
Now there's a few people that have L6s. It's not like the most common thing,
Yeah.
but it's not rare either. Okay, so painful here.
Just
a little bit.
it's just like, I don't know, the best way to describe it is tight and just no little movement. Yeah, right in there, right where you were.
Yeah.
Like when you push on it, I feel like kind of like a sharp, almost like a little sharp pain right in here. But this is like what I told you when I have like a migraine.
Mhm.
This part kind of bulges out, like you could noticeably feel it. It's almost like a pebble, you can.
Okay.
And I typically when I massage it, my head feels a little better,
Yep.
So that's
I'm gonna do you one better right now.
okay.
I'm gonna adjust it. So
Okay.
alright, so I'm gonna adjust this. Actually, what I'm adjusting is your skull onto your spine.
Okay.
So that'd be a little different than what you've ever gone
Okay.
before. So what I'm gonna do, okay, so we're just gonna push this over, okay? So just relax here. Okay.
Mm-hmm.
Not too bad, right?
It felt good actually.
Good. Yeah, so what I did was I shifted your skull isn't entirely ridden up like that, right?
Okay.
Like I told you in the room. So just shifted it back down.
Okay.
Just
And it's
sideways.
just this side that you. So if you do that, then this will kind of.
Exactly.
Wow, that feels a lot. I mean, yeah, feels good.
Good.
It felt good. Good.
Put a hip here, and you're just gonna relax here. I'm gonna give this a little push forward, okay? So just relax here. Give this a push
Wow, yeah. Felt that. Yeah. Oh man. Wow.
How's that?
That felt good. Wow. Okay. Feels better. Would icing help this?
It could, but honestly, what we just did, like over here,
Mm-hmm.
this is all like clear into here now. So I think it's gonna get better on its own. It's doing what I want it to do.
Okay.
If it didn't, then I would want to see if I can adjust it again. But we should be good for today. I mean, it should. I mean, how do you feel?
I mean, noticeably different. I mean, just the first. I mean, obviously the first time, but it felt good. I feel like I have more just from you kind of moving my body. I have a little more movement.
Good.
So,
Awesome.
yeah.